Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Jalucel Plus. Jalucel Plus is indicated for heartburn relief during pregnancy. And doesn't every pregnant mom suffer of that sometimes? The way it works is the following. Jalucel Plus has a dual action effect. First, it forms a raft or a barrier over the stomach contents and help keeps the stomach acid in its place. Second, it neutralizes stomach acid. Jalucel Plus gets to work fast and is longer than traditional antacids. So it's got a lot of benefits. Jalucel Plus is obviously suitable for use in pregnancy and safe. It's got a non-systemic antacid effect. The flavor is lovely. It's got a licorice flavor and it provides rapid and longer symptomatic relief versus other antacids. It's easy to use. You only take 10 to 20 ml after meals and before bedtime. Thank you, Jalucel Plus. Hi everyone, welcome back to another episode for the Birth and Baby show. And for today's episode, I've got a very, very special guest that's very close to my heart. And her name is Seba Batsu-Tsoane. She's a midwife and a nurse and an activist and a model and an entrepreneur and just everything. And I've got her to talk about today's topic, and it's about cervical cancer. We are starting a series about let's talk about it. And there are some topics that are not really so nice to talk about, but we do need to talk about them. And it is Cervical Cancer Awareness Month. And I thought it's very, very important and suitable to get this conversation going. So hope you enjoy this one. Hey Seba, how are you doing?
Hi, Doc. I'm good, and how are you doing?
Yeah, I'm very well. I'm so glad that we get to do this together. We've been planning this one for some time. So let's just jump in there, Seba. Tell the audience a little bit more about yourself and the work you do.
All right. Hi, Dr. Margreet, as well as your audience. I hope you're doing well. And thank you so much for having me. As you've already heard, my name is Baba Tsawane. I'm a registered nurse midwife. I'm also the founder and CEO of Black Women Women's Health Foundation. So I'm just very passionate about women's sexual and reproductive rights. I'm really excited about talking about cervical cancer because it really is one condition or one subject that is very close to my heart. So I look forward to the show today.
Yes. Thanks, Seba. That was a short introduction. I know there's a lot about you, and you're doing currently really incredible work in and around the communities and the women and reproductive health. Just know that you are the right person to talk about these topics. It is a sensitive topic, but we do need to talk about it. Cervical cancer awareness is important. Why would you say it's so important, Seba?
Okay, so as I said, that I'm very passionate about women's sexual and reproductive health, and my passion really comes from, like you said, the topic or anything that's related to sexual and reproductive health is often regarded to be a stigma. And I've seen through personal experiences as well as my own experience as a healthcare professional that many times women tend to visit healthcare professionals when they're very late in their stage of illness. And you find that by the time they reach a healthcare professional, there's little or nothing that can be done. And cervical cancer really is a classic example of this because, it's been called the silent killer, particularly because for the longest time, a woman can actually live with cervical cancer and only discover that they have it when it's very advanced or when they even need to in palliative care because it's so far advanced that little or very nothing can be done.
Yeah, so as you were saying that, Seba, I was wondering, does everyone actually know what cervical cancer is? Maybe explain what it is.
Okay. So cervical cancer is basically when you have cancer on the mouth of your cervix, which is actually the cervix. So it's basically when your cells, in a normal situation, what happens is you have cells that are regenerating and you have cells that are also, degenerating. So when there's an imbalance of cells that are actually growing more than they should, then that's when you get cancer. So this in cervical cancer, this actually happens at the location of your cervix. And what one thing to also note with cervical cancer is that it actually can be detected in its precancerous self or precancerous state, which is why we really encourage women to get screened so that the precancerous cells can be detected and be removed before they can actually become cancerous. So yeah, that's what cervical cancer is.
Yeah, thanks for that. So with everything, prevention is always better than cure, but most of the time cancers, what can we do to prevent them? We can try. But with cervical cancer, how can we prevent it from happening? Because I know there is something to the cancer that's unique to cervical cancer.
So thank you so much for that question, Dr. Mahid, because cervical cancer is actually one cancer that is, I would say, 100% preventable, because what is or the one virus that is responsible for the majority of all cervical cancer, I think it's up to 99%, is actually the human papilloma virus. So this is a sexually transmitted virus, and it can actually be prevented by vaccination. As things stand now, the Department of Health is actually having a campaign where 10-year-old children are being vaccinated for HPV, which can then later prevent cervical cancer. And then the second thing that can be done to prevent cervical cancer, as I said, is to really screen regularly so that it can be detected in its precancerous state. And then once, the precancerous cells are detected, then they can be removed. And then furthermore, the most important thing is to really have lifestyle modification that can ensure that you are healthy enough to ensure that you don't get cervical cancer. Things such as not smoking, delaying sexual debut, not having multiple sexual partners, and also just eating healthily, because all of those things actually increase your risk of getting cervical cancer.
Great. So that leads me actually to the next thing I wanted to ask you is then, who is more susceptible for getting cervical cancer? It's probably interlinked to what you just said.
Yes, definitely. And then I think what I also need to mention is that cervical cancer is much more prevalent in women that are HIV positive. And more than anything, it also progresses much faster if you're HIV positive because of, your immunity being suppressed. So that's why we also encourage women that are HIV positive to screen more regularly than the ones that are HIV negative. But furthermore, anyone who is sexually active can get or is at the risk of getting cervical cancer. And then another thing that also increases your risk is if you have someone in your family that has had cancer. Let's say if your mother or someone in your family has ever suffered or even died from cancer or cervical cancer itself.
So the uniqueness of the cervical cancer is that it's actually caused by a virus, which is unlike other cancers, and it's actual sexual transmitted disease. So I think it's important for women to know that. Then they can empower themselves accordingly to help prevention. How prevalent is the HPV virus? Do you know?
I don't have the exact stats with me now, but I know it's very common, particularly because sometimes we find that in men, they can actually be carriers of the virus without showing any symptoms. So now you find that a woman that perhaps was not even sexually active can have sexual intercourse with a man who has had sexual intercourse with somebody else and had the virus and then become infected with the HPV virus. So yeah, it is quite common.
Hence the silent killer, you said.
Absolutely.
Okay. All right. So you've mentioned already how important it is to do screening because of it. You might have it in its precancerous state, but be totally unaware of it. So tell us a little bit more how this screening works for cervical cancer.
Okay, so we make use of a pap smear to screen for cervical cancer. We currently use what is called liquid-based cytology. So you will now have to obviously visit your healthcare professional, ask for a pap smear to be done. Then, the healthcare professional will then explain the procedure to you. And then, you will need to, fill in a form with your information, and then a lab form will also be filled in. And then you will be asked to lie down. And then there is a piece of equipment that is called the speculum. I wish I had it here with me to show you. But yeah, it's a disposable, a plastic speculum that the healthcare professional will then make use of to open up your vaginal cavity so that they can be able to envision or visualize rather your cervix. And then they will go in with a small and soft brush in circular motion just to pick up the cells that are found there on the outside and some that are on the inside of your cervix. And then these cells will then be sent to a lab where they will then be examined to see if they are cancerous or if there's any potential of them being cancerous in the future.
Great, yeah. So that pap smear that we all have heard about, now we know why. Hey, they're no fun. No one likes getting them, but they are important. Hey, so how frequently do women need to do that?
Okay, so as I've already said that in HIV positive women, cervical cancer it progresses much faster. So we according to the national guideline, what we'll say, or the policy rather, what we'll say is that for women who are HIV positive, we start screening them from 20 years old, and then they can screen every 3 years. But for women who are HIV negative, then they can start screening at, let's say, 30 years old, and then they can then screen every 5 or 10 years. But what I will also say is, in as much as that's what the policy said, you do get outliers of women who are not HIV positive, but who do get cervical cancer much earlier than we would expect. So we do encourage any woman to go for their annual checkups and to also start doing their pap smear as soon as they start being sexually active, just to ensure that they're on the right side, particularly if you have family histories.
Okay, so there you have it. Get them done. And Seva, once you get a result from your pap smear, just unpack a little bit the results that you can get and follow up.
So there is a number of different results that you can get. You can get results that say, okay, you're all clear, there's nothing to worry about. You will be screened according to the national guidelines. And then there's also results that show that you might have precancerous cells. Then it means that these precancerous cells actually need to be removed, which is, the stage at which we actually prefer to get the cervical cancer. Or you might actually have, results that indicate that you might have cancer. So what usually happens is once we've screened you, then you will then be referred to the next level of care based on your results. And then that's where you will be followed up. If you already do have cancer, then, whether you need to do chemotherapy or any other treatment related to that will then take place.
Okay. Wow. Yeah. So it's a very treatable cancer. That's what I'm hearing from you. And the success rate of helping you to overcome cancer is high if you get if you screen and if you detect it. That's the word I'm looking for. On time, right? Yeah. All right. Okay, so that is, I think, very powerful information to empower women to prevent them from any form of cervical cancer. And anything else that you would like to share, Seba, that you think is important that we haven't touched on?
Yeah, no, I think the biggest thing for women to know is to really love their bodies, know their bodies, understand what is normal for them, that the minute they start seeing something that is ordinary, they can reach out to a healthcare professional, because really we only have one body, so it's important.
Absolutely.
Yeah.
Yeah, that is very, very great advice. Awesome. Okay, well, thank you so much for sharing your information and a little bit about the work you do. And keep up the amazing work. And we hope that many, many women are going to listen to this and empower themselves as well as their sisters, that we don't have any woman dying of cervical cancer anymore.
All right. Thank you so much for having me, Doc.
You're welcome. Thanks, Eva. We'll chat again.
Bye.
Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.